the YouTube live book reading of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. I'm your moderator and narrator, Uriel Riley. Welcome, welcome, YouTube. Yay. We're going to finish out with chapter 9 today. So, here we go. Let's do it. We pick up at page 180 at the top. Aid to bronchial hygiene. Desiccated and retained secretions are hydrophilic, i.e., they absorb water. Since dried, retained secretions cause significant pulmonary pathophysiology. Chapter 8. It is appropriate to attempt to restore and maintain the mucus blanket, although it is possible to increase the water content of secretions by systemic hydration, IV, and oral fluids. This has little effect on dried, retained secretions present in the airways prior to systemic hydration. The rationale for the administration of aerosol therapy as an aid to bronchial hygiene is to attempt to 1. Hydrate dried, retained secretions. 2. Restore and maintain the mucus blanket. 3. Promote expectoration. And 4. Improve the effectiveness of the cough. It is clinically apparent that where retained secretions exist, high volume aerosol therapy may be effective in mobilization of those secretions with improvement in pulmonary function and blood gas exchange. Peace. Welcome, YouTube. Thank you for reading books with us. This peaceful part of YouTube, we are reading Clinical Application of Respiratory Care. Thank you so much. Love to all the book lovers community. We're on page 180 in the middle. It is our opinion that intermittent high volume aerosol therapy is extremely effective in aiding bronchial hygiene and must always be accompanied by other appropriate techniques to promote expectoration of high volume aerosol therapy for 30 minutes every 4 hours will accomplish as adequate mobilization of dried retained secretions as a continuous ultrasonic aerosol. We believe little is to be gained from continuous administration of high volume aerosol, but it does involve potential hazards, which will be discussed shortly. Humidification of inspired gases. In circumstances where the upper airway is either bypassed or rendered inefficient, the application of aerosol therapy to assure proper humidification of inspired gases is indicated. Aerosol is preferred to humidifiers because artificial airways can better be kept moist and free from obstructive dried secretions. We prefer pneumatic reservoir mainstream jet nebulizers that are heated rather than continuous high volume therapy. Top of page 181. Deliver medication. Peace, Leslie. Thank you for being here. The delivery of medication by aerosol will be discussed in Chapter 13. However, it must be mentioned here that aerosols are the method by which medications are delivered to the tracheobronchial tree and lung parenchyma. Studies have shown that most groups of drugs administered by aerosol therapy are not disrupted in the pharmacologic action by being delivered by aerosol route. We prefer side stream intermittent jet nebulizers for this purpose. Administration of aerosol therapy. Review of the medical literature concerning aerosol therapy presents conflicting and even diametrically opposed conclusions. The most likely explanation for this is the complexity of studying aerosols. It is our contention that aerosol therapy is an extremely effective modality when the clinical goals are kept clearly in mind and when properly administered. Therapy must be judged not only on its rationale, but also on the skill with which it is administered. If the prescription for aerosol therapy is rational and the therapy is applied skillfully, the results are both rewarding and dramatic. The proper technique for the administration of aerosol therapy for purposes of bronchial hygiene comprises basically four steps. The patient is placed in proper body alignment for maximal breathing efficiency and postural drainage when desired. Two, the patient must be instructed to breathe through his mouth and to breathe slowly and deeply. A slight inspiratory pause is ideal. And three, the patient must be instructed in diaphragmatic breathing to assure that the maximum distribution and deposition of aerosol will occur in the basilar areas of the lung. And four, cough instruction or cough assistance must be concomitant with the administration of aerosol. Hazards of aerosol therapy. Welcome, YouTube. Thank you guys for the likes and subs. Thank you for being here and reading with us. Divine Rising. Happy Wednesday. The proper technique for administration of aerosol therapy for purposes of bronchial hygiene comprises basically four steps. One, the patient is placed in proper body alignment. Yeah, okay. Hazards of aerosol therapy. The hallmark of the efficient application of any treatment modality is the capability of recognizing and dealing with the potential hazards associated with its administration. We feel that there are four well documented hazards of high volume ultrasonic hydrodynamic aerosol therapy that must be understood by the respiratory care practitioner. Swelling of dried, retained secretions. Bottom of page 181. Dried, retained secretions result in partially obstructed airways, which can become completely obstructed with the addition of water. These secretions are hydrophilic, water loving, and will swell when they absorb water. This results in acute lower airway obstruction and has caused death. Certainly, any individual who has had clinical contact with ultrasonic nebulization has experienced the circumstance where a patient manifests acute dyspnea and respiratory distress after shortly after the initiation of therapy. A patient should never be left unattended while receiving ultrasonic therapy, especially during the early treatments. The water content should be carefully and gradually increased as tolerated. It is essential that efforts be made for mobilization of secretions immediately upon starting the aerosol therapy. Precipitation of bronchospasm. Aerosol droplets are foreign bodies that can precipitate bronchospasms. It is essential for the therapist to remain in attendance during ultrasonic therapy of any patient who has a tendency toward bronchospasms. This may be an indication for administering a bronchodilator before or with the ultrasonic treatment. Peace, YouTube. Welcome. Thank you for being here and reading with us. Clinical application of respiratory care. And we are now in the ninth chapter, closing this one out. Thank you for the likes and subs. Thank you to all of the book readers out here in YouTube world. All of you. Hi, it's Hot Love. Fluid overload. Fluid overload has been reported as a problem in infants receiving continuous ultrasonic aerosol therapy. However, an exhaustive search of the literature has failed to show documentation of fluid overload in the adult receiving intermittent therapy. Since intermittent ultrasonic therapy seems to be as effective in bronchial hygiene as continuous therapy, it seems reasonable to limit ultrasonic therapy to intermittent treatments, except in specific circumstances such as patients with cystic fibrosis. Cross contamination. Of great concern to all associated with respiratory therapy is the potential for infecting a patient through the respiratory therapy equipment. Hospital infections that are transmitted by particles are a type of no oh, nosocomial infection. Transmission of nosocomial infections via therapeutic aerosols has been extensively studied. It is incumbent upon all in respiratory therapy to assure that equipment is properly sterilized. However, we must be aware that all aerosol generators utilize room air, and despite excellent attempts to filter the air, the water reservoirs are inevitably contaminated with bacteria from the room. Since hospitals are notoriously associated with severe and dangerous airborne infections, it would stand to reason that therapeutic aerosols in the hospitals would be a frequent source of contamination. An extensive culture program of respiratory therapy equipment should be devised by each department. Results of this can produce guidelines for routine changing of equipment. It is incumbent upon all in respiratory therapy to do everything possible to assure that patients will not be cross contaminated. It is impossible to protect the patient from his or her own organisms or from the organisms in room air, but She or he must be spared introduction of organisms from other patients in other locations. The inviolate rule of respiratory therapy must be that there is room for question about the efficacy of therapy, but we can never tolerate harming the patient with our therapy. There we go. Completion of chapter 9 in respiratory or clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. We completed another chapter. Thank you so much for being here and reading with us. Hi, it's Heart Love Random Guy. Yes, we love math, and we're reading physiology and anatomy now to help people that want to get their MCAT. We're reading it live for free. This is thousands of dollars of information, and we're reading to you free here, live from the light here in LA. Thank you for the likes and subs. We're pushing. We just got to 500 subs reading books on this peaceful part of YouTube. We read books and learn from masters. I'm Master Uriel the Riley, Master Fitness Trainer, traveled around the world training pro athletes, and a natural healer here at LA. So we love to be of service to the community. And speaking of that, today is Wednesday, grocery giveaway. Yes, yes. Here at South LA Cafe. So we love you. Make sure you come out, get your ticket early so that you can pick up your groceries and leave out and help feed your family and friends. And it's again for free. So this is part of being an establishment in community and being of service to community is to give away things for free. So in this YouTube community, we give away information and self knowledge for self mastery. We give that away for free. So thank you so much for the likes and subs. Hi is Heart Love. We're shaking it up in the world, reading books, loving on one another, and uplifting one another. Thank you so much. Wow, that's a beautiful random guy. Said nice, nice. Oh, nice decoration. Hi is Heart Love. Thank you. Yes, you know, it's a sacred place. So show love and uplift one another here on this peaceful part of YouTube, corner of YouTube. We read books and learn from masters. And we tell one another we love each other. Mm. I love you. I love you. I love you. Love water to the people. Make sure you come out, get your groceries if you're in the LA area. All it is love and friendship and camaraderie when you come and get your groceries, South LA Cafe, and it's free and it's loads of groceries that are healthy for you. So just playing our part. Had a wonderful, wonderful session yesterday out in Hollywood. And I wish you have a magical, wonderful September 3rd. Hi, it's Heart Love. Thank you so much. Peace, peace. I will see you soon, and we will start on chapter 10 in reading this book. I love you. I love you. I will see you soon. Love you, Bubbles, all the families and friends. Peace. See you soon, okay?